Royal Canin Research Centre is a major producer of scientific knowledge relative to dog and cat obesity. Since 2008, 20 scientific peer-reviewed articles relative to dog and cat obesity have been published, and more than 10 abstracts presented in international congresses over the past 2 years, either by internal research teams or through partnerships. Research focuses on all aspects related to obesity, such as nutritional management of overweight pets or clinical trials of new products, and it also addresses a broader knowledge of this condition. This includes epidemiology, risk factors, diagnosis and methods of measuring body composition, pathogenesis, associated diseases, as well as the benefits associated with weight loss. In 2005, the Royal Canin Weight Management Clinic in Liverpool was established as a joint venture between Royal Canin and the University of Liverpool. Since then, over 200 overweight dogs and cats have been examined and treated here. This is the first veterinary referral clinic in the world dedicated to the treatment of obesity. It is also an important research centre, and since 2008, more than 20 scientific papers have been published based on work done here. The clinic is run by Alex German, PhD, specialist in veterinary internal medicine and senior lecturer at the university, and Shelley Holden, vet nurse.
The Weight Management Clinic is a unique venture worldwide. Primarily, it's a referral service for vets in practice who have problems with overweight dogs. So they refer cases to us, and then we examine them and we manage the weight problem in that particular pet. By doing that and being positioned at the university here, we actually have the opportunity also to undertake high quality clinical research where we can advance knowledge in the field of obesity management. Well, obesity is actually quite a major disease. It affects both quality and quantity of life. There's actually a very famous lifelong feeding study in dogs that where they looked at 2 sets of dogs, some that were fed ad lib and were overweight and others that were restricted. And the dogs that were allowed to eat what they wanted, they effectively didn't live as long and they had many diseases associated with it. The quality of life comes from many of the disease associations that you see. That can range from osteoarthritis to diabetes mellitus, to pancreatitis, respiratory disease, and certain types of cancer. So all in all, it really affects the life and the well-being of our pets. Well, the clinic actually is a partnership, and there are many people and many partners involved. So we have the client and their pet. We also have Shelley, our nurse, and me. Shelley and I initially will see the cases, we'll examine each of the animals, we'll take a medical history. Then we perform certain tests like blood tests, urine tests, blood pressure. And to determine how overweight the pet is, we perform a thing called a DEXA scan, dual energy X-ray absorptiometry. That determines body fat, allows us to set the target. From there, we can tailor a weight program involving diet and exercise specifically for that individual dog, and then it's a process of following him through till completion.
The Weight Management Clinic is run by enrolment of patients as referral from their own veterinary surgeons. Their vets contact us, and then we contact the owners to make an appointment for their animals to attend the clinic. What happens is I contact then the owners direct and send them out a questionnaire prior to them coming to the appointment. And with that questionnaire, what we're doing is finding out as much information about lifestyle of the animal, so looking at feeding habits, exercise, general day-to-day habits of the animal and how the owners exercise and play with their animals. They send that back to me, and then we arrange for them to actually come and spend the day here with their pet. At the actual start of the appointment, we go over that questionnaire and discuss it in greater detail. Then I will actually weigh the animal. I will take some body measurements, so take some morphometric measurements, looking at measuring their chest, their waist and their neck. I'll obviously body condition score the animal as well, and take some photographs. And we'll take some blood samples, we'll monitor the animal and take blood pressure from the animal. And if all is well at that point, I'll then sedate the animal, the dog or the cat, to perform a DEXA scan. We will then sit down and we'll have a look at the results of the DEXA, and then I'll discuss those results with the owner, and then I'll actually set a programme for the animal to go home with. So within that programme, I'll then discuss the new diet regime for the animal. We'll look at a complete new exercise plan. We'll talk about behaviour changes. Once the animal leaves the building, we'll then contact them within 24 hours to see that they're happy with all the information, because there's a lot of information to take home on the day. And then we'll arrange an appointment for 2 weeks for the animal to come back for a revisit. Once the animal has then reached its target weight, we then see them back at the clinic, and more or less the whole initial appointment is repeated, and then the final outcome is then discussed again with the owner, and then we look at discussing then a maintenance programme for their pet. I think the more then you get involved in weight programs, you start to learn that every animal's different, every owner's different, so every weight program you deal with is different. You may have sort of a set protocol to follow, but each one has to change for the individual pet or owner. I then learnt over the years and realised how important a weight management programs were for pets, and the importance of the animal being a correct weight, because the welfare issue was big, and you start to see the difference that weight loss has on animals, the effect that it has on their exercise, their quality of life, their mental and physical well-being, and to see that you play a huge part in improving that for the welfare of the pet and the owner, again, is very, very rewarding as a nurse.
This joint venture has been a total success. Obesity has proven to be a challenging disease, and there is still a lot of research to be done in the field. But the Royal Canin Weight Management Clinic is making a difference in how it is treated. We are really proud to help improve the quality of life of these dogs and cats.